I'm Tom Viola. I am a pharmacist, and I've been lecturing and speaking in pharmacology, dental pharmacology, for the last 30 years. My website, tomviola.com, has lots of resources. The name of my company is Pharmacology Declassified. And here's my expert tip for today. I work with my students in the clinic, in the dental schools on a regular basis, and I often talk to them about medical histories. And one thing I can tell you from consulting in dental offices for as few years as I have already is that we always typically ask that same question. Any change to your medical history? No, we ask, any change to your medications? And invariably the answer is, nope, no changes. And that's because it's easier to say no than it is to delve into the whole medical history and the medications you take. So I often ask a medical history with 3 questions. I start off with, number 1, what do you take? And I don't use the M word medications or the D word drugs because I don't want them to limit that question and the answer coming to just those things. Because when I say the word medication, people think of little bottles from the pharmacist, and they don't think about the over-the-counter drugs and the herbal supplements and some of the other substances they take on a regular basis. So I want to get that all in. That's part of the medical history. Then I ask, why do you take it? Because I want to know if the patient knows why they take medications, why they self-medicate with over-the-counter drugs, why they take dietary supplements, why they use certain substances, and how would that impact our dental treatment plan. Some medications cause bleeding, some over-the-counter drugs cause bleeding, some herbal supplements cause bleeding, just as an example. So there's a lot there as far as what I want to know about what you take that can impact dentistry. And the third question I ask all the time is, did you take it today? Because I have a lot of patients on blood pressure medications that don't take blood pressure medications. So they're prescribed, they sit in a bottle, and they don't take them. And so that impacts me because when I take your blood pressure during the visit and it's elevated and you tell me you're on a medication like Norvasc, I'm asking questions as to why. The greatest reason why I think a medical history is important now has to do with substances. Marijuana, cannabis is becoming more and more part of our lifestyle, more and more part of our lives. And cannabis, unlike medications that we know a lot about, or over-the-counter drugs we know a lot about, we don't know much. And so it's a bit of a gray area. But one thing that's very important is that we do know that the person's using cannabis, because of the little things we do know about cannabis. We know that it makes patients more difficult to anesthetize. We know that it makes patients somewhat resistant to anesthesia. And we know that it raises blood pressure, it raises heart rate. And those are all things that are important in dentistry because we use drugs like epinephrine and local anesthetics, which can have similar effects. So that's why taking a medical history to me is the most important thing we do in a dental appointment. And that's my expert tip for today.